Hello, my name is Dr. Moshe Appel. I am a clinical psychologist and I have a group practice called ADO Psychology Center where we specialize in treating anxiety, depression, OCD. And I also post videos on these topics on my website, which is adopsychology.com. So the topic for tonight's talk is crisis strategies. How do you manage yourself during a crisis? So usually when we find ourselves in a crisis, there's some kind of traumatic event happening, either to us, our family, our friends, or in the world. And during traumatic experiences, we often feel like our sense of safety is shattered. There's lots of uncertainty. We might feel out of control. We might feel like life is unfair or pointless. So tonight we're going to talk about 14 strategies to manage yourself during a crisis. I'm going to go one by one. I'm going to go through them pretty quickly. So fasten your seatbelts. First, all responses are valid. And you may have heard this before, but it's so important because I can't tell you how many of my patients experience issues because they're unwilling or unable to accept why they're feeling a certain way. So if you're feeling anxious, if you're feeling out of control, if you're feeling hopeless or pointless, just know that it's okay. During a crisis, it's okay to feel whatever you feel. All emotions are valid. All responses are valid. But next, it's important to understand the function of emotions, and this is number 2. Our emotions are there to help protect us and help guide us. Very basic example is if you don't feel anxious, you're not going to prepare for something. So if you don't feel anxious before a test, you might not study. If you don't feel anxious before or during a crisis, you might not do anything to solve it or get out of it. So if you understand the functions of emotions, instead of saying, my heart's racing and I'm going crazy and what's happening to me, you can say, no, my body's doing what it needs to do to keep me safe, and that's what it's there for. And that could, again, make you feel more comfortable with accepting your emotions. The third one is identify and label your emotions. So instead of saying I'm feeling out of control or crazy, try to be more specific. I once had a supervisor that said, claim it, name it, tame it. Pretty much if you claim the way you're feeling and you name it, this is anxiety, this is depression, this is my heart rate increasing, then it's much easier to tame it and be okay with it than if you feel completely out of control. Number 4, physiological relaxation. If your body is really feeling like it's going out of control, you can do things to calm it down. And these are things like the tip skill from DBT, like putting cold water on your face, or initiating a dive response by putting your face into a bucket of ice water, for example. You can do deep breathing. You can do progressive muscle relaxation. You can Google physiological relaxation strategies, and you're going to come up with many. Any one that works well for you is worth giving a shot. But that's just to calm your physiological body down. The next skill, number 5, is taking care of your physical needs. And again, from DBT, this is the please skill. But the idea is in a crisis, we can neglect our needs, our bodily physical needs. So for example, you might not be eating properly or drinking properly. And you might feel like, how can I eat when this is going on? But the answer is if you want to be able to function and deal with the situation much better, you have to take care of your physical body. And you can have a friend or a family member help you make sure you're taking care of your physical body. But it means eating well, sleeping well, trying to keep social connection as much as you can. The next one, and perhaps one of the most important skills, is maintain your routine as much as you can. And this applies especially to people who are experiencing a personal crisis. Something's going on in their lives, or they're feeling depressed, or they have like a terrible situation happen to them. As much as you can maintain your routine, that is probably one of the most important skills. You may feel like you want to stay home, you want to take a mental health day, mental health week, and I'm not saying that you never should. But what I am saying is, during a crisis, as much as you can, you want to maintain normalcy and routine in your life. Number 7, you want to differentiate what's in your control versus what's out of your control. And so instead of ruminating and thinking about the terrible things that have happened, that have already happened or out of your control, use all that energy and drive and put it into things that are within your control. So instead of saying like, how did this happen to me? I have no idea. Say, okay, it happened. We'll deal with it later, maybe why it happened, preventing it from happening again. But currently, I'm not going to even spend my energy and time there. I'm going to delineate. I'm going to make very clear what exactly is in my control in this point and focus all your energies there. Number 8 now. You want to lean into your resources as much as you can. What are our resources? Well, it may be family. It may be friends. It may be God, it may be Hashem, it may be davening, praying, maybe saying Tehillah, maybe learning, maybe doing good deeds. But there are so many resources we have around us. We want to lean into them. Instead of going about it alone or trying to figure it out for yourself, lean into the people around you who actually are there to help you, including your religion, which often is a very helpful place for people to lean into to feel a little bit better. Number 9, find your mission. What can you do to participate in solving the crisis or helping the crisis instead of feeling like there's nothing I can do? Almost always there's something you can do. And at a minimum, perhaps you can pray or say Tehillim or something like that. But at a maximum, you could actually do things in addition to that by helping people. So you can either figure out how you can help the crisis or help yourself in the crisis, but find very practical things that you can do and make that your mission. So again, we're talking about instead of having this energy and fear going nowhere, let's channel it into the right direction. And ultimately, that will not only help the crisis situation, but actually help yourself very much as well and make you feel like you're back in control and you're contributing and you're dealing with it in a healthy way and a productive way. Number 10, stimulus control. What does that mean? In short, all that means is be intentional with what you're exposing yourself to. So if there's something going on in the world, for example, then instead of watching TV all day or watching news videos all day or reading the news constantly, if ultimately it's not so helpful for you and it's just getting you more depressed and more down, then don't do it. So this is something that comes up a lot, especially during primary seasons or during political events where people get very heated and each side is watching their side of the television, the Fox News for some people, CNN for other people, and they're just getting more mad and more mad and more mad. How could the other side believe this or do this? But if ultimately it's impacting your quality of life and you can't go on your day because of it, then control it. Choose for yourself not to watch the news all day and only watch it for 10 minutes or only read the news. So stimulus control, or don't expose yourself to social media that keeps being triggering for you. So stimulus control means be more intentional with where you look and what you're exposing yourself to so that you're not constantly being triggered within the crisis. And number 11, have a safe space to express your thoughts and your fears, not obsessively, but to a decent degree, because people need to be heard and need to feel like they're being heard. So this could be a therapist, it could be a friend, but find somewhere where you can actually express yourself without being judged or told how to think about a situation. Because usually in these situations, cognitive restructuring, which is a skill we often use in therapy to help people change the way they're thinking about situations, but during a crisis or during a traumatic event, usually it's not helpful. It's actually more helpful to let the natural process flow and just be validated and supported until a later time where you can change your way that you're thinking about a situation if that's helpful. There's one exception to this, which is if you are feeling unsafe. In reality, you are safe because the crisis didn't affect you directly, or maybe it did, but it already passed, but you're still feeling so unsafe, like this is bad, I feel very unsafe, like it's a dangerous situation that I'm in, even though for you it's really not. That's where cognitive restructuring could be a little bit helpful, reminding yourself, like, no, the traumatic event was actually bad and unsafe and dangerous and terrible, but for me personally, I currently am safe now. So that's something that's often helpful to be reminded in those situations. But other than that, you just want to be validated and supported, not really told how to think, and just let the natural process go. Number 12, and we're coming to the end over here, find some positive things or things to be grateful for. So usually even within an event, maybe the way people are reacting to it and coming together and helping each other, don't only focus on the negative. Try to think of some positives to focus on, or even outside the event, things you can be grateful for. The fact that you're still living or breathing or seeing or being able to walk, or try to find some positive things to balance out what a lot of the negative is. Number 13, you want to think about your life as a past, present, and future. Because in the moment of a crisis or a trauma, you might be so focused about what's going on right now that there's like a tunnel vision, and it's so hard for you to recognize this is just one chapter of my life. And maybe a year or two later when you look back, you say like, it was a bad situation, but like my life has moved on since then. And there's a lot more to life than just that one event. So in the crisis, it's important to remind yourself, yes, currently things are terrible, but there was a past, this is the present, and there's also a future. And remembering that full circle, that full journey can be helpful for you to tolerate the current situation as well. And number 14, last but not least, designate a specific time to deal with the crisis in a problem-solving way so that you're not dealing with it all day or ruminating all day. And this is a tip we give to people with generalized anxiety disorder as well, which is, yes, you're worried about a lot of things, and perhaps some of them need you to worry and solve and figure out, but don't do it all day long constantly. You want to say, okay, 6 p.m. until 7 p.m. or until 6:30 or until 6:15, 15, 20 minutes, an hour, whatever it is, that's when I'm going to devote to focusing on this crisis, on problem solving, what I'm going to do about it. But the rest of the day, you don't want to have to constantly be swamped by it, because then you're going to be so exhausted and you're actually not going to be able to deal with it in a healthy way, and it's going to affect your mental health as well. So this applies to the situation we're talking about now, but also to general anxiety. Instead of thinking and obsessing and worrying all day, just minimize it to a specific time. Whenever thoughts come into your mind throughout the day, just tell yourself 6 p.m., 6 p.m., 6 p.m. And that's when I'm going to be dealing with it then, versus being fully swamped by it all day. So just to summarize here, there are lots of skills that could be helpful, but what I would say the top 6 skills are as follows. First, all responses are valid. So don't get hyped up or anxious about your response. No matter what you're feeling, it's okay. All right? And it's valid and it makes sense in the moment, given the situation. Number 2, physiological relaxation. Take care of your physical needs. So calm yourself down, do exercise, do deep breathing, do progressive muscle relaxation, do the tip skill, like I mentioned before. And take care of your bodily needs. Eat well, sleep well, drink well. You probably won't be able to, and I know that. But try. Don't just give up on it. And don't feel like, how can I eat when people are suffering? Or because ultimately you're going to end up damaging yourself and others and be unhelpful for yourself and for others. So as much as you can, take care of your bodily needs. Maintain routine, perhaps the most important skill in all of this. Lean into your resources, including religious resources, family resources, friends resources. Don't go it alone. Don't isolate. Don't withdraw. Number 5, find your mission or what you can do to participate in helping. So you could be focused in a positive direction. You could channel your energy positively and productively. And last but not least, again, stimulus control and set aside time to deal with the crisis. So don't be watching videos all day long and constantly being triggered. And don't be thinking about it all day long. Try to designate specific times instead of being swamped all day long. And ultimately, of course, during these moments, a therapist can often be helpful. And sometimes family is great as well. But don't feel shy to reach out to a therapist, even if it's just for 1 or 2 sessions during the moment, of the crisis. So that's it for tonight. If you have any questions, you can contact me through my website, adopsychology.com. That's ADO Psychology. And you can also view my other videos there on other topics related to anxiety, depression, OCD. And have a great night. Look forward to see you next time. Take care.